Common ingredient used as a sugar substitute has been linked to higher rates of heart attack and stroke.
CBS 2's Dick Brennan has the results of a new study.
Artificial sweeteners are widely used as no or low-calorie alternatives to sugar, and now research from the Cleveland Clinic finds at-risk people need to avoid them.
The study that is making the headlines today refers to a chemical called erythritol, commonly found in stevia. It's found in other low-sugar foods, and it is shown to have an increased risk of heart attack, stroke, and blood clots in people that have risk factors for coronary artery disease, such as diabetes.
Dietitians say the ingredient has become increasingly common in diets.
Erythritol gained popularity because of the keto products and because it's non-caloric, but it is an artificial, so synthetic ingredient. So as a longevity dietitian, I wouldn't recommend it to anyone because your body does not recognize it.
In response to the study, the Calorie Control Council, an industry association, said the results should not be extrapolated to the general population, as the participants in the intervention were already at increased risk for cardiovascular events.
It is true, depending on the population group that's being studied, right? Most healthy adults, they're able to metabolize this ingredient, right? But those who have a compromised immunity or compromised health conditions, and it leads to a higher risk of developing heart disease.
So what does the average person do? For one, keep track of your heart health with your doctor and look at labels when you buy things. Then the experts insist, lay off the sweeteners.
Artificial sweetener use is linked to increased obesity, abdominal circumference, metabolic syndrome, which is high blood pressure and high cholesterol. So, I mean, just use a little bit of regular sugar and call it a day.
Call it a day. People who are at risk and participate in those low-calorie or even some of the keto diets should be extra careful. Of course, anyone should be consulting their doctor when trying any of these different diets or the radical diets. Maurice and Christine.
Well, I guess when you have something artificial and something,
That's a problem.
It's something to think about, right?
It certainly is. You got to be careful. You got to check with your doctor that you're okay.
No
Thank
doubt.
you, Dick.
Okay.
All right. Well, a secret society in Brooklyn. A fly